that was a 3-year program, and before I graduated, Sage Memorial Hospital had accepted me and started recruiting me into a nursing position for an infection control officer. So I accepted that job and eventually grew into a director of quality management once I graduated and passed uh, my nursing NCLEX. So that was my first degree, the bachelor's of science in nursing. And I went back to school about a year later, and I earned my master's of science in health administration, and which was very helpful because once I became a nurse and earning the BSN, the CEO for Sage had started mentoring me in administration and just telling me about the operations and the management side of it. And I stayed here for about 3 years and went and then applied at Fort Defiance, where I worked for an additional 4 years. And during the 4 years, the CEO, who was Dr. Freeland, had mentored me as a CE for a CEO position. So that was a 3-year period. And at that time, I earned my master's health administration degree. And then I continued on and I worked at Winslow Indian Healthcare Center for an additional 4 years. And Sally Pete, who was the CEO at Winslow, had again taken me under her wing and mentored me for the time that I was there. And after I left there, I started working on my master's jurisprudence in Indian law because I wanted to understand the Public Law 93638 and what it really meant to have that sovereign, the self-determination, the self-governance side, and how we could exercise that as a healthcare organization. But I left Winslow and started at San Carlos Apache Healthcare Corporation, where I spent 7 years and really learned a lot about self-determination. And I graduated at that time with my master's jurisprudence in Indian law. And since I was so close to finishing my master's of science in nursing, that's where I earned 2 degrees, was in San Carlos. So I do have a bachelor's of science in nursing, a master's of science in nursing, a master's health administration degree, and a master's jurisprudence in Indian law.